This article had so much potential, but then it quickly developed into woke buzzword bingo, with an added bonus of the tiresome trope of blaming the evil white straight men for all the pliffs of medicine and society at large. Well done. The author misses the mark on understanding professionalism. This is either a failure of her educators or an indication that she still doesn't get it. Definitely a lot of discriminatory and harmful comments here. Hating each other and bullying each other is not going to fix the problem. Attacking fellow physicians for what they're wearing, for not being professional. How do I feel right now? This is an emotion I haven't felt and didn't expect to feel, honestly. My name is Dr. Moss. I'm a psychiatry resident. Today, I'm going to react and respond to comments, very harsh and caring comments about the Doximity article that I wrote at the beginning of this year, Why Medicine's Definition of Professionalism Needs to Change. How professionalism is used as a weapon in medicine. The reactions were intense. The last episode, I talked about more of the article. I gave more information about professionalism, what I went through, and what other medical students, residents, and doctors have also experienced. It's been 2 months now. I really tried not to read the comments. I read some of them, and they were a lot. And thinking about them, 2 months ago, it was right before I took step 3. Wonder if that could have been reason for my failure. Anyway, in the comments that I'm about to read, you're going to see that I'm not alone. A lot of people responded. This hit a nerve in the medical field, this article. I did not mean to hit a nerve. I was just sharing my experience. Since going public, I've been contacted by so many people through Doximity, social media, email, and in person, thanking me for this article. Because people are terrified to share this. They're terrified being dismissed from medical school, terrified of being kicked out from their program, terrified of speaking up, for just sharing their own experience of struggle, of humanity, of being human. So let's get into these. I'm going to work really hard. I'm going to do some very important steps on how to respond. Number 1, I'm going to set boundaries with myself. I'm not going to say names. I'm not going to respond directly by chat. I'm not going to say names, even though it is public, at least for medical people. You can see the comments. You can see their specialties. You can see their names. You can even click them and see where they go to, but I'm going to say that they're a doctor. I don't know how they identify, if they're male or female. They have pictures, so I can guess their racial identity. But again, I'm not, because I tried not to when I'm sharing my experience. But anyway, so I've given myself 2 months to calm down. You'll see me taking breaths, using all my mindfulness that I teach my patients, because I'm going to take deep breaths. But anyway, number 2, I want to appreciate everyone who read this and commented, because it was a discussion, and that is phenomenal that it started a discussion. But there were also a lot of personal attacks on me, on other individuals that look like me. So I'm going to be respectful, because that's what we're supposed to do. We're talking about professionalism. This is what professionalism is: being respectful, having a discussion, and not attacking others. Maybe if I can identify the emotions from that statement, that would be cool. I'm going to bring up my emotions wheel. This is actually a good practice for me, thinking about it, because this is what I do in psychiatry with my patients. Learning how to just respond, instead be defensive, or respond to whatever statement they're saying, but maybe say, you sound like you're very angry with the situation. That is actually a really good idea. I actually have been enjoying doing different emotions wheels with my patients on the inpatient group therapy that I run because it's so helpful, especially for individuals like me who've been through trauma and who've been through challenging experiences in their life. So it was actually the first thing my therapist gave me when I was in first year of medical school. So I'm going to identify what feelings I have during this. So it's going to be a therapy session for myself and also see if I can identify the emotions that these individuals are sharing as like comments on my article on professionalism. Because the point was to share my perspective, to spark thoughtful dialogue. I'm going to work on using I statements, keeping my tone personal and grounded, not accusing anyone, and stating I'm open to feedback. And I've worked really hard to share my story in hopes that it would help others feel seen and heard, not demeaned. Okay, you ready for this? I have my water. I should probably also get tea. I'm already anxious, if you can't tell, but I'm in a good spot right now. I have a full 24 hours while my husband's at his 24-hour residency call shift. So plenty of times to decompress and read through this calmly without attacking others, but sharing that you're not alone. Okay, let's start from the very top. This is by, I'm going to say their specialty. Why not? It's just interesting to see. I wonder if different specialties act different ways. And so this is one of the hematology doctors said, "We are timid and industrious animals, of which our government is the shepherd. Compassion and dedication will always be abused by those with power to exploit it in the name of compassion and votes, of course. Compassion will always be abused." What does that mean? Kind of sounds a little dismissive in response to advocacy, which is interesting. There is some skepticism, and it almost sounds like compassionate. It almost sounds like this person is saying that compassion is a weakness, but it's actually the foundation of medicine, and I would say of professionalism. But it doesn't change what I stand for, the kind of doctor I want to be. And this person isn't wrong that power can be taken advantage of and corrupt. And this is why I'm saying that we need people to advocate for others. What do you think about this one? This one I'm confused about. Okay. This is a doctor from PM&R, Physical Medicine Rehab. Insightful, well written, and something that many of us can connect to. But you might not get too many comments because of fear of speaking out, even in a social media platform. Thank you for speaking up. Thank you, doctor. And there is a lot of positive upvotes on that. And I did respond to that one, saying that I appreciate their encouragement, feedback, and that it was hard to write this, but I'm in a safe environment. And the doctor responded, "Not everyone is able to find that, and I recognize that." Oh, and then a lot of people are responding to, let's get into the negative criticism that this individual, at first I was like, is this a troll? Is this a bot? But they kept attacking. So it could be, but this individual isn't it. I don't, sure. I said it for other one. This individual is an anesthesiologist, which has nothing to do with their specialty. It's interesting that they said it. And then a lot of people commented on theirs because they attacked all over the place, not just me, but a lot of people who were commenting. After reading the first two paragraphs, this article had so much potential, but then it quickly developed into woke buzzword bingo, with an added bonus of the tiresome trope of blaming the evil white straight men for all the pliffs of medicine and society at large. Well done. Which, again, stay calm. And if I were to respond to this in writing, but here I am, Doctor, I appreciate you taking the time to read the article, even if it was just the first 2 paragraphs. It's unfortunate that my advocacy for equity and acknowledgement of systemic issues in medicines is easily dismissed as woke buzzword bingo. There are lived experiences by myself and those shared by many students and physicians, as you can see on the other individuals who have commented, and especially those from underrepresented backgrounds, not just by race, but sexual orientation, gender, heritage, disability, ability status, health conditions. The point isn't to blame individuals. It's to address and acknowledge patterns that harm this profession of medicine as a whole. And so we can only move forward if we're willing to listen with humility and curiosity, not hate, not sarcasm. Especially dismissing these concerns as buzzwords undermines the real experience of countless physicians. And my intention wasn't to villainize anyone. And let's actually read through the article, because I recognize that this person felt very victimized, and you can tell the emotions that this individual was saying. The main emotion I'm seeing was probably angry. He was very angry because he felt targeted, felt frustrated, felt insecure. So a mix of afraid and angry. Instead of showing trust or intrigue or sadness. Let's see exactly what this individual is saying. So he's saying the first 2 paragraphs, and then I go in the 3rd paragraph, I say there are a set of unspoken rules, often labeled as hidden curriculum, that some students know instinctively, while others like me are left guessing, which include not speaking unless spoken to. So nowhere do I talk about race yet. It was the 4th paragraph. I then talk about marginalized groups are disproportionately subject to being labeled as unprofessional, including women, people of color, LGBTQ plus individuals, and those with disabilities receive most scrutiny. And I show the research from the medical school graduation questionnaire, which showed that individuals in medicine with an increasing number of marginalized identities experience a disproportionate amount of mistreatment and discrimination while pursuing their medical degree. Again, I did not talk about race in attacking. I said these group of individuals have been targeted. Let me do Control F. Here it is. I worked really hard to make sure I did not state it until I discussed a lot of information first. I said, medical culture built by white, able-bodied, heterosexual, cisgender men punishes those who don't conform. I'm saying the medical culture which was built, not who they are currently, but definitely through stating that, this person felt like I was attacking them. So they felt angry. They felt maybe helpless. There was some contempt. And that's where it is feelings of scorn and hate to try to protect themselves, which is a trauma response, I'm going to say. Okay. Now let's move on to, I really appreciate this doctor, pediatrics individual, who said, the fact that a bunch of white men are dismissing the article is proof of exactly why the article needs to be written and exactly what the author is calling out. And then there was a smiley laughing face, and a lot of people upvoted it. I appreciate you saying that comment. And of course, that same individual felt again targeted and said again more disrespectful things. Okay, I can't possibly go through all these because there's right now 160 comments and there's constantly more comments, but you can get the gist of what's going on here. And it seemed that this individual, by saying "great point, sir, bravo," was using sarcasm as a way to deflect. I appreciate this individual who commented, he a cardiology doctor. There's a stark difference between constructive criticism and criticism of things not done your way. Not everyone uses the process of growth and improvement as it was meant to be. And then there were some comments on what does hidden disability mean? Because I went back and forth on my article with my editor, deciding like, do I say invisible disability? Do I say mental illness? And yeah, I went on hidden because sometimes we try to hide because we're not accepted for being who we are. And it's not just a physical disability or a mental disability or diagnosis. But it's sad that this individual commented, does hidden disability mean inability to perform? Or is it a label for internal struggles we all have? Well, I'm glad that they at least said internal struggles that we all have, because that is a point. We are all human. We all struggle. We all, at some point or another, are going to have health conditions. But then they do get a little more hateful. I don't like this. I have plenty of optimistic folks tell me they hope to become a doctor, but we need to judge whether aspiring physicians are capable. This capability. And this is really sad that this individual is a family medicine doctor, because family medicine doctors see individuals from all ends of sphere, all ages, incapable. Just because someone, and you should know even better, just because someone has a health condition has nothing to do with their capability or ability to pass exams, to be empathetic, to be professional. Sometimes when I see things like this that bring up capability against others, I wonder if it's a defense mechanism of wondering of, I struggled so much, so it's not possible for anyone else with an obvious struggle to do well. Because I already struggled so much. Anyone who actually has more struggles, it's not possible for them to achieve. I talk about this on failure step, how individuals become so defensive when we tell them that we failed step, and they respond, oh, you're never going to become a doctor. You're never going to match. I'm wondering if because they themselves maybe failed an exam, but didn't fail step, and they barely got a residency position. And so they're wondering, oh, if someone failed something even harder, there's just no way they can get it. It's almost like they feel, that's a good word I'm looking at, maybe ashamed. Maybe they feel uncomfortable, which is part of being ashamed. And it's so sad that this individual finished respectfully, and then they end by being unrespectful. The author misses the mark on understanding professionalism. This is either a failure of her educators or an indication that she still doesn't get it. But that's exactly what I'm talking about. Professionalism is subjective. Every single doctor and educator has a different view of what professionalism is. And in my article, I do state, I finally found something that was like, okay, someone's able to give a definition. And this was, professionalism is the habitual and judicial use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflections in daily practice for the benefit of the individual and community being served. Let's see where I got that. I got this from a article talking about the due process of medical education for legal, because as you can see my previous episode, when people are dismissed for professionalism, sometimes they do go to court, either if it's just to let them go back to school, to let them have a letter so they can apply to other medical schools, say that they didn't go through due process. I'm not a lawyer, so I can't discuss all of this, and I still don't understand this, but at least from reading this article, you can get of all the people that have gone through failing, being kicked out of medical school. It says failure of courses, failure of step exams, clerkships, and lack of professionalism. Okay, let's keep going. This is an interesting one. I don't see how wearing atypical clothing or not completing our patient care duties because of our own limitations is something to be praised. It's interesting because, as I said in my previous video, it's not that I didn't complete them. I did complete my notes, just not in time that a resident wanted and didn't notify me. And then the atypical clothing, I said different colored scrubs. It's interesting. And then they say, there's certain standards of uniformity which we all must hold in order to uphold the prestige of our profession. End quote. I'm going to step away from that. I disagree with that. Uniformity, that's exactly what I'm talking about in this article. Uniformity, clones, that's not true because we are all human. And even if we all wear a white coat, all dress exact same way in a uniform, we still are individual humans that are different. And then this person continues in quotes. If your loved one had sepsis, an ICU attending entered the room in tie-dye scrubs and a unique hairstyle, would this make you feel they were in good hands? End quote. It makes me think of don't judge a book by its cover. And even if you do naturally judge, because we are humans, we naturally judge, you of all people as a physician know that how someone looks does not mean anything about their capabilities. You don't know if their washer machine broke so they couldn't wash their clothes. You don't know if they had to borrow someone else's clothes that day. You don't know if they're going through bankruptcy and have to wear the same scrubs every single day. This is definitely getting to that I should step away. This was a psychiatry doctor. Quote, she also described experiences in medical school. As an atypical, older, added child, previous career student, I had very similar experiences. Sometimes we need to hear what a writer is telling us rather than finding holes in it. If you look closely, a number of us identify with this young doctor shared with us. The dissenters seem to be male. End quote. Thank you. Not that the last part need to be said, but I appreciate you saying that there are many people that identify with, and I was sharing my experiences in medical schools, and now I haven't shared experiences in residency, but I know that they exist. But I've learned how to respond, how to manage my emotions now. Thank you, psychiatry doctors. But anyway, I like this other doctor in psychiatry, end quote. Bravo, Dr. Moss. Thank you for speaking up on this. Haters recycling tired arguments, railing against identity politics and DEI boogeyman, and ultimately propping up a medical system rewarding behaviors that lead to terrible patient outcomes, physician burnout, and moral injury. End quote. Yes, thank you. Yes, this is also a thing I could talk about forever. This attacking each other, attacking fellow physicians, attacking physicians for what they're wearing, for not being professional, for not trying to get rid of them because they failed an exam instead of teaching them how to recognize their own mistakes, learn from them, and move forward. Because that's the most important thing in medicine. But anyway, attacking this pain is one of the many reasons why doctors are quitting medicine, why doctors are sometimes going towards mental illness, substance abuse, sometimes committing suicide. There's an extensive amount of doctors burning out, and we need to help them. And hating each other and bullying each other is not going to fix the problem. Definitely a lot of discriminatory and harmful comments here. I've worked hard to share my story. I hope it continues to help others. I am open to feedback of how I can improve how to talk about professionalism, how to support others, but not to be bullied, demeaned, dismissed. How am I feeling right now? I actually feel better than I thought I was going to be. And I guess some of them that I had read multiple times, so it wasn't like the first time I read it. Like I said, there are many more. You can go read yourself. How do I feel right now? This is an emotion I haven't felt and didn't expect to feel, honestly. Pride. I feel empowered that people wanted to, or at least talked, not everyone comments. But this time it hit a nerve. And that means people are struggling. Even if they can't express all their emotions, they're in pain. And I think this, maybe to sum it off, this is exactly what I'm talking about. Medical professionals and doctors are in pain. I feel encouraged that people read the article and had enough to actually commented, had the bravery to at least share the pain or share the acceptance. There's definitely a lot of pain, a lot of anger, sadness, disgust, but also thankfulness. So thank you everyone for listening. Put in the comments if you've read the article, how you would have responded. Sometimes silence is louder. Sometimes I pretty much have responded to the positive ones, upvoted ones. But I know I don't want to get into it with those individuals because sometimes silence can be more powerful than just listening. That's what I'm doing. It is sad that people are struggling. Thank you for listening. Share this article, share this video of what you think with others. We need to have these conversations, even though they're tough and they bring different emotions and strong emotions, I see. Thank you for listening. My name is Dr. Moss. I'm a psychiatry resident. I changed to Steph Moss MD on social media, but you can still see all of my writings that I've written about all the challenges, about the hidden curriculum in medicine. You can see my other podcast episodes on life as a patient doctor, on different struggles that I've had, and other individuals that have shared their story in medicine. So thank you, everyone. See you next time.